Hi, my name is Dr. Lenny Salzberg, and today we're going to talk about Weight Loss Clinic, and this is your new patient orientation. Welcome. If you've been on the waiting list for the Weight Loss Clinic and you finally made it, congratulations, you finally made it. If you just decided to join the Weight Loss Clinic yesterday and you got an appointment today, wonderful. We are going to try to take you through about 40 minutes worth of material tonight and help you get ready for your weight loss journey. I want to start out by talking about our team. So our team is your team to help you with weight loss. We have multiple people on the team, including providers, pharmacists, registered dietitians, behavioral therapists, and our wonderful staff. Your providers include nurse practitioners and PAs and physicians. Pharmacists will help review your medicines, see if there's any medications that are causing weight gain that we need to eliminate, and help you choose medications that will help with weight loss. Dietitians will help you with your food choices. The behavioral therapist will help you realize when, why, and how you're eating. Our staff will help you through this whole process. So the first question I have for you, and I want you to think about this, is why are you gaining weight? What are the factors that have caused you to become heavier now than you were before? Usually when I ask people this, they tell me it's stress, or they're eating too much, or they're not exercising, or they were born this way. There's a lot of factors that contribute to gaining weight. One answer is genetics, environment, and less activity, the perfect storm. Did you know that if you have one parent who's obese, you have a 40% chance of being obese? If you have two parents who are obese, you have an 80% chance of being obese? So there's a lot of genetics involved in what we eat, how much we eat, when we feel full. The environment plays a big factor as well. When I was a kid, I remember McDonald's served hamburgers, and if you got a quarter pounder, that was a huge deal. Now quarter pounders are the norm, and very few people order a regular hamburger. The environment also relates to how busy we are with cars and mass transportation. And less activity relates to this as well. When I was growing up, we had gym every day in school. My kids in public school here in North Carolina had gym 2 days a week. When I grew up, we had recess, and we played all day at recess. Nowadays, kids sometimes get recess, sometimes don't, and there's less physical activity. It's not just kids. All of us as adults, we have less physical activity. We're more desk-bound, and we're less active. We don't walk to places, we drive to places. So why should we care about obesity? Why do you care about obesity? There are a lot of conditions associated with obesity, and this is part of the reason I care. As a physician, I worry about your health. Your health includes high blood pressure, strokes, heart attacks, high cholesterol. There's a direct correlation with your weight and your risk for high blood pressure, high cholesterol, and diabetes. Did you know that some cancers are associated with obesity? That's right. Prostate cancer, breast cancer, colon cancer, all are associated with being obese. Depression is associated with obesity. Depression can lead to obesity, and obesity can lead to depression. Gallbladder disease is commonly seen in people who are overweight and obese. Gout, eating disorders, sleep disorders, mood disorders, osteoarthritis. People with obesity are more likely to have low back pain, hip pain, and knee pain than patients who are not obese or not overweight. There's also social prejudice, job discrimination, medical bias, limited access to health care, and low self-esteem, all of which can be improved with improving weight. So what is the good news? The good news is 5 to 10% weight loss can definitely improve your health. 5 to 10%. So if you weigh 200 pounds, 10% of 200 pounds is 20 pounds. 5% is 10 pounds. We're not talking losing 50 pounds. We're talking 10 to 20 pounds if you weigh 200. and that can help normalize your blood sugar, reduce your blood pressure, and reduce your blood cholesterol. This brings us to the most important slide of the evening: how we address obesity. If you notice, there's a pyramid on the slide. On the bottom of the pyramid are diet and physical activity. What this means is the cornerstone or the basis for all obesity treatment is diet and physical activity, lifestyle modification. That is what has to happen regardless of whether you use medications, whether you don't use medications, whether you have surgery, whether you don't have surgery. Diet and physical activity are the key. Now, lifestyle modification includes psychological interventions. Some of us eat when we're anxious, depressed, or sad. Some of us eat when we're angry. Dealing with that and addressing that really makes a difference and helps us with our weight loss journey. Sometimes diet and physical activity is not enough, and medications are needed. During this orientation, I'll talk about 5 medications that have been approved by the FDA for long-term therapy for weight loss. But I'll also emphasize that medications are not the answer. They're just an adjunct or an add-on to diet and physical activity. And our goal in this weight loss clinic is, if we use medications, and again I say if, because you can be part of our clinic without medications. If we use medication, our goal is to get you off medication within 6 months. The medications are approved for long term, so if you do get on medications and decide to stay on them, we can continue them. But our goal is to get you off in 6 months. Notice the top of the pyramid is surgery. Surgery is not the answer for most people, but for people who have much higher body mass index, or BMI, so over 40, or BMI over 35 with comorbidities of diabetes, high blood pressure, obstructive sleep apnea, then surgery might be indicated. We do not do surgery here at the Southern Regional AHEC. If you are interested in surgery, usually most insurance companies want you to demonstrate that you've tried to lose weight through medical management for at least 6 months. This program will be documentation of that 6-month trial. And when you do go to a surgical practice, and we have one excellent one here in Fayetteville called the Kafer Valley Bariatric Center of Excellence, if you do decide to have surgery, it will have helped that you've tried diet, physical activity, and medications. I'm going to give you one homework assignment. The homework assignment is, I need you to keep a food and activity log for 24 hours. Now, 24 hours may not seem like long enough, but let me tell you, keeping a food log is really hard. What I want you to do in your food log is record what you eat every time you eat anything. So if you are walking by and you grab a snack, grab a handful of grapes, I want you to record that. I want you to record where you were, when you ate, how much you ate, how the food was prepared, and how you feel when you're eating. If you can, I'd also like you to record the type of exercise and intensity of exercise or activity you're engaging in that day. Just do this assignment for 24 hours, and that will help you realize what you're eating and when you're eating, and just doing the recording will decrease the amount you eat. Bring it with you to your first visit, and when you talk to the nutritionist, hopefully the nutritionist will review this with you, or the physician will, or the pharmacist will. I want to teach you a technique called the fill your plate method. Look at this picture. Look at the plate in the center of the picture. What do you notice? The thing that jumps out at me is that half the plate is filled with vegetables. A quarter of the plate is your protein. A quarter of your plate is your starch. Next to your plate is a fruit and a glass of milk. That plate represents what you should be eating for an entire meal. So if this is dinner, that would be your dinner. If this is lunch, that would be your lunch. Most people, when they think of their plate of food, they fill half their plate with the meat or protein. This emphasizes that vegetables are the important part of your meal. They fill you up, and they're not calorie dense, and they're good for you. We're going to focus on what's called a low-fat, high-fiber diet. Basically, low-fat, high-fiber diets are not calorie dense, and they fill you up. I want to draw your attention to the two salads on the bottom of the slide. The salad on the right has ranch dressing on it. The salad on the left has no dressing on it. Otherwise, the salads are identical. The salad on the right has 336 calories and 31 grams of fat. The salad on the left has only 40 calories. Think about it. By adding that ranch dressing, you've added almost 300 calories. You've made something that's very healthful and good for you into something that's not so good for you. We'll talk about ways to fix that and ways to prevent the ranch dressing. This slide is about meat and protein. And basically what I want to point out is that meat is good, protein is good. You need about a quarter of your plate with your meat or protein. But the less fat in it, the better it is. So you choose lean, low-fat meats. You want to avoid processed meats or high-fat cuts. And baking, broiling, grilling, poaching, or stewing is better for you than frying. The picture on the bottom shows a piece of chicken and a person's palm. That's about the size of the portion, is the size of your palm. I'm going to make a big point that a nutritionist taught me years ago, and that is, for protein, the fewer the legs, the better it is for you. So how many legs does a cow have? 4. How many legs does a pig have? 4. They're not very good for you. How many legs do chickens have? 2. How many legs do turkeys have? 2. They're a lot better for you than beef or pork. How many legs do fish have? None. How many legs does tofu have, or tempeh, or vegetable protein? None. Those are even better for you than turkey and chicken. So the less legs, the better. What about milk? Milk gets a bad rap. Milk is actually good for you, as long as it's low fat. And the key point I want to make here is that skim milk has half the fat of 1% milk. 1% milk has half the fat of 2% milk. 2% milk has half the fat of whole milk. So whole milk has 8 times the fat as skim milk. If you can eat skim milk and cheese made out of skim milk, you'll be much better off. Fruit. Fruit is actually good for you. Fruit has a lot of fiber in it. Fruit doesn't get absorbed as quickly as juices. One of the biggest mistakes people make is they juice fruit. Avoid juices. Don't drink juices. How many oranges does it take to make a glass of orange juice? You can't eat 3 whole oranges and not feel full. You can easily drink a little 6-ounce or 4-ounce glass of orange juice and still be hungry. We should eat 2 to 4 servings per day of fruit. If you think of a regular apple you get at the grocery store, that's 2 servings of fruit. A banana is 2 servings of fruit. Fats. Fats are essential, but we want to use as little as possible. Look at the picture in the bottom right. It's a measuring teaspoon. That's how much added fat to use in an entire day. I'm sorry, an entire meal. Another useful fact about fats, look in the top right corner. You see butter and then a couple oils. One of the things that I've learned is that if the fat is solid at room temperature, it's saturated and not so good for you. If it's liquid at room temperature, it's unsaturated and it's better for you. So olive oil, canola oil, vegetable oils are liquid at room temperature. Butter, burger fat after you fry burgers, those are solid at room temperature. Avoid those. Coconut oil is solid at room temperature. It's not as good as olive oil. Vegetables. Now, vegetables are the best because you can eat an unlimited amount of non-starchy vegetables. What do you do when you're hungry? You eat more vegetables. You want to avoid ranch dressing. You want to avoid any heavy salad dressings, but you can eat as much salad as you want without dressing. You do want to limit the starchy vegetables. So what are the starchy vegetables? Potatoes, sweet potatoes, corn, peas, beans, legumes, pumpkins, plantains, yucca, and yams. Those are starchy vegetables. I don't even consider them vegetables. But when I think of vegetables, I think of broccoli, cauliflower, asparagus, zucchini, yellow squash, carrots, peppers. Those are the vegetables I think of. They are good for you. You can eat more of them. Salad, lettuce, it's good for you. What about grains and starches? Grains and starches are an essential part of our meal. It used to be, when they did a food pyramid when I was a kid, it used to be the base of the pyramid. Now we say eat 2 to 3 servings of starches per day. You want to choose whole grains. Servings are like half an English muffin, 1 piece of toast. That's what you should eat. The more whole grain, the better it is because the less quickly it's absorbed. Soups, if you talk about broths, are great. If you talk about creamy soups, they're bad. The picture on the bottom is a creamy broccoli soup. That cream is heavy, dense fat, not good for you, but broths are great for you. Sweets. I have to confess, I am a chocolate lover. I love dark chocolate and I eat sweets if I can. The best way for me not to eat sweets is not to have them available. Keep temptations out of the house and you're less likely to eat it. I used to eat ice cream all the time, and then I realized, if I don't buy ice cream, I won't eat it. So there's no ice cream in my house, so I don't eat it. The best advice for sweets is avoid them. Condiments, we talked about ranch dressing. Ranch is just one example of calorie-dense dressing. All condiments count. Some condiments that have very little calorie density, vinegars have no calories. Lemon or lime juice have basically no calories. Herbs have no calories. Mustard has next to no calories. What's full of calories? Salad dressings, mayonnaise, Miracle Whip, full of calories. What about beverages? One piece of advice that I like to give people is don't drink your calories. When you eat food, it makes you feel full and it tells your brain you're done. When you drink calories, it doesn't make you feel full. They're completely wasted. Avoid drinking your calories. So what do I mean drinking your calories? Avoid Coca-Cola, Mountain Dew, Dr. Pepper, Pepsi, sweet tea. Avoid all those things. If you want to drink tea, drink unsweetened tea. If you want to drink soft drinks, drink diet soft drinks. Even better would be just drink water. And if you need flavor, squeeze some lemon in it or put some strawberries in it or cucumbers. In the picture, it shows some water with kiwis in it. Shifting gears from diet to activity, anything is better than nothing when it comes to activity. One way to measure activity is with a step counter or a Fitbit, but you don't need that to be more active. One of the easy ways to add activity to your day is take the steps instead of the elevator or an escalator, or park far away from your destination, or become more inefficient. I'll give you an example of parking far away from the destination, and I'll give you an example of being more inefficient. So when I was a kid, my dad, growing up, my dad was obese, and when we went to the store, he would circle the parking lot over and over until he found the parking spot right in front of the store. What he could have done, and chose not to, is parked far away in the parking lot and walked to the store. It would have had many advantages. One is it would have been free exercise because he would have walked that distance both ways. 2 is when you park far away, there's usually spots, so it wouldn't take as long to find the spot. And 3, and I've experienced this myself, the further you park away from people, the less likely you are to get your car dinged. Becoming more inefficient. So when you bring groceries home from the market and you take them from your trunk of your car, rather than carry all the bags at once, make 5 trips. Carry 5 separate bags of groceries in. That inefficiency is burning calories. So there are 3 types of exercise. There's aerobic or endurance exercise, resistance or strength exercise, and stretching or flexibility exercise. All 3 are important. Endurance exercise improves your cardiovascular activity. It helps your heart. It's the most important exercise for making you heart healthy. Strength training, weight bearing, resistance exercises, those are the best for your bone density, muscle strength, metabolism, but also for losing weight. The bigger your muscles are, the easier it is to lose weight because those muscles require energy even when you're sleeping. Flexibility, stretching, is important for improving your health overall and reducing your chance of injury. It's recommended that you stretch before and after other activities. So what is aerobic exercise? Walking, running, swimming, biking. The goal is to do more than you're currently doing. So if you're doing 0, 5 minutes is great. If you're doing 5 minutes, 10 minutes is great. Any increase is great. And the most benefit is starting at 0 going to 10. You get more benefit going from no exercise in a week to 30 minutes of exercise in a week than you would if you were exercising every day and added an hour onto each day. So a little bit more is the biggest bonus when you start at nothing. We will try to get you to our goal of 150 minutes a week or more of exercise. Over 300 minutes a week, there's probably no more benefit to exercise, but between 150 and 300, it really helps. So resistance exercise, that's weights, rubber bands, push-ups, pull-ups, machines. If you look at the picture on the right, you see those bands. Those bands are resistance bands, and you can use them anywhere in the house or anywhere at work, and it will help you get stronger. The gray band is the hardest, and the blue band, which isn't pictured, is the easiest. But you work your way up from the easy bands to the hard bands. Or lift weights. Use light weights. If you don't have weights, use cans of peas or cans of whatever vegetables you have at home. If you don't have cans, just doing exercise without weights is good. More repetitions with less weight is better than fewer repetitions with more weight, unless you want to get bulky. If you want to build muscle mass quickly, you do heavy weights a few times. What about stretching? Stretching is very important. Without stretching, you get very stiff, and as we age, we lose flexibility. Stretching includes warm up and warm down. Other things that involve stretching are yoga, Pilates, Tai Chi. These are all good ways to get stretched. Switching gears to medication. So by now you're thinking, okay, diet, okay, exercise, I've heard this a million times. What about the medications? That's why I'm here. I want to emphasize again, you do not need to use medications to be part of the weight loss clinic. In fact, a lot of people choose not to be on the medications because they're expensive or they have side effects or insurance doesn't cover them. So we welcome you without medications. If you choose to use medications, I want you to know a couple things. One is medications do not cure obesity. I want to reemphasize, medications do not cure obesity. Let me give you a little thought experiment. Do you know anyone who has high blood pressure? Do you have high blood pressure? When you take high blood pressure medications, do they cure high blood pressure? No, they treat it. They get it under control. Same story with weight loss medications. They do not cure obesity. They help get the weight under control. Discontinuing medications may result in weight regain. Let me say that again. When you stop blood pressure medications, your blood pressure goes back up. When you stop weight loss medications, your weight goes back up. So why would we even use weight loss medications? We're going to try to help you lose weight with diet and exercise, but we may need to help you even more with the medications. But by changing your life and changing your exercise patterns and changing your relationship with food, we may be able to help you keep that weight off even without the medications. The other important point I want to make from this slide, 2 weight loss medications that were on the market for about 10 years, one known as Meridia and one known as Fen-Phen, were withdrawn from the market by the FDA because they killed people. Let that sink in for a second. Medications that we were treating people with for 10 years and thought were safe were not safe. Why do I say this? Because there are now 5 FDA-approved weight loss medications, but none of them have been on the market long enough to know that they're safe. Fen-Phen was on the market for a long time, as was Meridia. Fen-Phen caused valve problems. Meridia caused heart disease, and people died from both of these medications. So I'm going to talk about 5 medications that your prescriber may prescribe at your next visit. And I'm going to list them in order of effectiveness and in order of cost. So the most effective is the most pricey. The least effective is the least expensive. Notice at the bottom I wrote, no weight loss medication will be prescribed if you are pregnant. All of these medications are contraindicated in pregnancy. So if you're pregnant, we cannot use any of these medications. The 5 medications I'm going to talk about are Saxenda, Questionnaire, Contrave, Belviq, and Alli. Saxenda, also known as liraglutide, is also marketed as Victoza for diabetes. It's an injectable once-a-day medication, and it's very effective. It modifies the hormones in your gut to keep you full, and it works in your brain to decrease your appetite. Its main side effects are nausea and GI discomfort. You can't use this drug if you have a family history of thyroid cancer or a personal history of thyroid cancer, a personal history of pancreatitis, or family history of multiple endocrine neoplasia. When it's used as Victoza, the dose is 0.6, 1.2, and 1.8, and it comes in a pen. And if you notice, 0.6 milligram in the picture is the same starting dose of Saxenda. You use it once a day. After a week, you go up to 1.2, just like with Victoza, and after another week, you go up to 1.8. That's as high as the Victoza pen goes. The Saxenda pen continues to go up. So after 1.8, there's 2.4 for a week, and then 3.0, which is the max dose of Saxenda. It's an injection once a day under the skin. I can tell you from personal experience that the injection does not hurt. It's a little tiny needle. But some people are afraid of needles, and so this might not be for you. Questionnaire. Questionnaire is the next most effective and the next most expensive of the medications. I want to go back to the first medication. When I talk about expensive, Saxenda typically costs about $250 per vial, and when you get up to the 3 milligram dose, you need 5 vials a month. There are some prescription cards, there are some company-related discounts, but overall it's very expensive. Questionnaire is also expensive, but not nearly as expensive as Saxenda. Questionnaire is a combination drug of phentermine and topiramate. You might have heard of fen-phen before. Phentermine is half of fen-phen. Phentermine and fenfluramine was fen-phen. They thought it was, or they think it's the fenfluramine part that caused the valvular problems. Phentermine is also sold separately as Adipex. We don't prescribe it because it is frequently abused and it's only FDA approved for 3 months. And there's a black market for it. Topiramate is a medication that's also used for seizures, and it's also used for migraine headache prevention, and it's also used for pain. It comes together as a pill, and it's a once-a-day pill. It modifies the hormone in your brain to keep you full and decrease your appetite. It has lots of potential side effects, including paresthesias, which is funny feelings, change in taste, headache, insomnia, mood changes, and constipation. It's contraindicated if you have glaucoma, thyroid abnormalities called hyperthyroidism, and kidney abnormalities. Speaking of the kidney abnormalities and the thyroid abnormalities, if we are to prescribe any of these medications, we will need recent labs, and we've ordered those for you. If you've had labs in the last year, we didn't order labs. Contrave is a twice-a-day oral medication pill that's also a combination pill. It's a combination of buproprion and naltrexone. Buproprion is also sold under 2 different names, Wellbutrin, which is used for depression, and as the medication for smoking cessation. I'm blanking on the name right now. But it's used, both of these indications for weight loss, all these indications, weight loss, smoking cessation as Zyban, and antidepressant as Wellbutrin. It modifies the hormones in your brain to keep you full and decrease appetite. Its side effect is it can increase your blood pressure, and if you have a seizure history, it increases your risk of more seizures. Naltrexone is a medication that's very similar to Narcan and is used to block opiates. It helps decrease your appetite by working on your brain. It can cause possible mood changes. It can cause nausea. This medication is contraindicated, or you can't use it if you're already on opiates because it'll block the opiates. If you're on antidepressants, we have to be really careful about prescribing this. If you have seizures, we can't use it. And if you have uncontrolled high blood pressure, because buproprion can raise your blood pressure, we can't use this medication. Belviq is the fourth most effective of these medications and the fourth most expensive. It's a twice-a-day pill. Its generic is called lorcaserin, and this is actually somewhat similar to the fenfluramine, but they think it doesn't cause valve problems. It modifies hormones in your brain to keep you full. It works on the serotonin receptor. It can cause low blood sugar if you're diabetic. It can cause headache. It can cause symptoms of an upper respiratory infection, and it can cause nausea and vomiting. We can't use this drug if you have kidney disease, if your creatinine clearance is low. If you have heart valve disease, again, it's somewhat related to that fenfluramine. Or if you have psychiatric history, especially with delusions or hallucinations. The reason for that is if you took the whole bottle of this, it causes hallucinations. So we're worried that if you already have hallucinations, it'll trigger more. You also can't use this if you have a drug addiction history because it is a controlled substance. On February 13th, 2020, 1 year after this video was originally recorded, the FDA requested that the manufacturer of Belviq, lorcaserin, withdraw this medication from the market due to increased occurrence of cancer. The manufacturer did withdraw the drug, and it's no longer on the market. This makes the third medication the FDA withdrew from the market due to adverse events. First was fen-phen, then Meridia, now Belviq. When the FDA approved Belviq or lorcaserin in 2012, they required the manufacturer to conduct a clinical trial to evaluate safety. What they found was that Belviq is associated with a large number of cancers, including pancreatic, colorectal, and lung. The good news, the FDA doesn't recommend you need special screening if you've taken lorcaserin in the past. So you get routine colon cancer screening age 50, you get lung cancer screening if you're a big-time smoker, but Belviq does not make you need screening. Finally, just to reiterate, Belviq is now off the market. Thank you. The least effective but also least expensive medication is Alli, which is a pill that you take with meals. It's also sold under different names, Xenical and orlistat. It does not work on your brain at all. It works in your gut to block the absorption of fat. Because it blocks the absorption of fat, the fat has to go somewhere, so the fat actually comes out your bottom and can cause flatulence and diarrhea. We can't use this drug if you have a history of anorexia or bulimia or gallbladder disease. Several things about Alli. If we do prescribe it, I recommend you don't take it if you're going on a car trip because you want to be near a bathroom. And I recommend you don't take it if you don't eat because it only works when you eat. One way we use it is to modify your diet. So if you don't know how much fat is in your diet, by taking Alli, you can figure it out pretty quickly. When you take Alli and you have a high-fat diet, you'll be running to the bathroom. When you take Alli and you have no fat in your diet, it won't really affect you at all. So I mentioned labs. We may order the following lab tests: TSH, lipid panel, and comprehensive metabolic panel. Mainly we're looking at your kidneys, but we're also looking a little bit at your sugar and electrolytes. We may or may not order a hemoglobin A1C if you're diabetic or pre-diabetic. We'll probably leave that to your primary care provider. If you've had labs within the last year, you don't necessarily need labs. If you choose not to have any medications, you don't need labs. We will send you results of the labs by mail, so expect a letter. And if you don't get a letter in 2 to 3 weeks after the lab draw, let us know. We're going to ask you to fill out a questionnaire. The questionnaire may be sent to you by SurveyMonkey. It may be given to you in a hard copy. We're going to ask about your quality of life, about your pain, about your history of weight loss in the past. The reason we do this is because we found that this weight loss program helps people reduce pain and improve the quality of life. And it's really remarkable. Part of weight loss and an integral part of weight loss is counseling. We're going to do group counseling visits. Your privacy will be protected. The reason we do group visits is you can learn from each other. I want you to know that eating is related to your state of mind. Some people eat when they're sad. Some people eat when they're bored. Some people eat when they're lonely. Some people eat when they feel like they're neglected. Some people eat when they're getting too much attention. Counseling visits will be related to food and eating. These visits are essential to keeping weight off, and because of that, we require them as part of continuing in the program to receive prescriptions for medications. We believe that weight is only one part of your health, and we believe in a holistic view of health. There are other important components of your health, and they include relationships, mental health, hobbies, community involvement, and spirituality. You can't neglect any of these to lose weight, and losing weight won't fix your life unless you have healthy relationships, you have good mental health, you have hobbies, you're involved in your community, and you're active spiritually. Now, we need you to be aware that weight loss is just one part, and it doesn't make you good or bad if you lose weight or don't lose weight. So what are the next steps? So today is the orientation, the questionnaire, and the measurements. Some of our great staff is going to help you with measurements, including weight, and also waist and hip measurements to see if you're losing inches. A lot of times people lose inches and not weight at first because they're converting fat to muscle. And muscle weighs as much or more than fat, but it makes you slimmer and more healthful. Prior to the first visit, and even if you want to get it tonight, you can get labs. Then there's going to be multiple visits, and it's going to be over 6 months. Each month you're going to visit with a provider. Each month you're going to have a group visit with a behavioral health specialist, and each month you're going to have a group visit with a dietitian. The dietitian is available if you want to schedule individual time as well. There will be a copay with the physician provider visit and with the behavioral visit. There will not be a copay for the dietitian. Interestingly, Blue Cross Blue Shield and Medicare may cover group therapy visits with the diagnosis of obesity. Once you sign up, you will be contacted by our revenue cycle manager, Tanya Russ, to review your health benefits and patient responsibility. Or if you don't hear from her soon enough, you can call her at 910-678-7257. That number again, 910-678-7257, and her name is Tanya Russ. But she will contact you. Before you leave tonight, make sure that one of our medical assistants or nurses gets your weight and measurements. Please complete the survey we'll send to you via SurveyMonkey. And if you've not had labs in the last year, you may need labs. If you need labs, an order has been placed on the computer and you can get them drawn tonight or return a different day if you prefer. Finally, I just want to give thanks to Dr. Carolyn Apovian and the staff at Boston Medical Center for the use of their slides and for their expertise in weight management. This slide set has been adapted from their original, and a lot of what we do is based on what they do. Dr. Apovian wrote the book on obesity, literally, and she's also the lead author on the Endocrine Society's guidelines on the treatment of obesity. So she deserves a lot of credit for this. That's all I've got tonight. Thank you very much for your attention.